Around the world are racing to develop a vaccine for the novel coronavirus. There is another everyday killer that is causing billions of people to lead shorter and sicker lives. New data from the Air Quality Life Index, which converts particulate air pollution into its impact on life expectancy, has revealed that particulate pollution is the greatest risk to human life before COVID-19. And without strong and sustainable public policy, air pollution will continue to remain the deadliest thing for human survival after COVID-19. Now, working unseen inside the body, air pollution's pernicious impact on the lungs and the heart is cutting global life expectancy by as much as 2 years. However, the worst affected are the South Asian nations. The report has said that at present South Asia bears the global burden of air pollution, followed by Southeast Asia. 4 countries that account for nearly a quarter of the world's population, Bangladesh, India, Nepal and Pakistan, are amongst the most polluted in the world. And northern India, particularly, is emerging as the most polluted part of South Asia. The average resident of South Asia is exposed to particulate pollution levels that are said to be 44% higher in the last 2 decades. Now, according to the AQRL, particulate pollution in India has sharply increased by over 42% in the last 2 decades. 84% of the people live in areas that exceed the country's own air quality standards, and the entire population is exposed to levels that exceed the WHO guidelines. As a result, the average resident sees their life cut short by more than 5 years relative to what it would have been if the WHO guidelines had been met. More than 2 years if the national standard is met, and residents of Delhi could see nearly about 9 years of life added to their lifespans if pollution were to be reduced to meet the WHO guidelines. New findings from the AQLI also indicate that citizens in the states such as Bihar and West Bengal can add nearly about 7 years to their life if air quality standards were to meet the WHO guideline. Lucknow was seen as having the highest level of pollution in the country, and Uttar Pradesh, with a population that is 11 times, with a population of over 20 crore people, has pollution levels that are said to be at least 11 times greater than the WHO mandated guidelines. Meanwhile, a quarter of India's population is exposed to pollution levels that have not been seen in any other country, with nearly about 230 million residents of Uttar Pradesh on track of losing over 8 years of their lifespans relative to the WHO guidelines.